Well, nowadays, getting a straighter, more narrow nose is only a rhinoplasty away, but the use of this procedure is not limited to cosmetic reasons alone. It's also widely used to get rid of breathing problems. Facial plastic surgeon Dr. Greene tells us how nasal reshaping can improve your breathing. Welcome.
Thank you. Thanks for having me.
Okay, so how can this procedure improve your breathing?
Well, I think most patients who come to see me are aware of aesthetically what can be done with a rhinoplasty, that is used to reshape the nose and change the appearance. But very few patients are aware of the effects on nasal function that the surgery can have. And it sort of makes sense that if you're going to change the external structure of the nose, that may translate to changes on the internal airway. And I think this is important on a number of levels. First of all, for patients who are coming to see me for a rhinoplasty, if they have an obstruction they're not aware of, and if they're still breathing well, if that's not addressed during the surgery, they're at a much increased risk of having obstruction after the surgery. And then for patients who do have problems breathing and they come and see me, and if they say have a crooked nose or if they've had nasal trauma, you know, their form and function are really linked. So what I do is I aim to fix not only the appearance but also the inside of the nose, and really you fix both simultaneously.
Okay, now Dr. Greene, what are some of the questions that people should ask when they go to see you or a plastic surgeon regarding this procedure?
Well, I think they should ask me if I'm going to be addressing their function as well, and I think they should really, it's important for patients to know the plan prior to proceeding with surgery. I always make certain that the patients, before we go to the operating room, I make sure they know exactly what's going to be done, and I tell them what their airway looks like, and I make sure we're on the same page before we go back for surgery.
Did you see that app, that iPhone app that we were showing earlier in the show, that you can kind of reconstruct your own nose and then take it over to your plastic surgeon?
I think I've heard of that.
What do you think of that?
Well, I think that can be, I guess, interesting to do. Actually, I do that for my patients. I do imaging in the office for patients. It can show you one of a number of different outcomes a surgery can provide a patient. But it's kind of a fun thing, I think, for patients. They come in and they like to see at least what can be done with their nose. It's more of a fun thing than anything, the iPhone app, I think.
All right, Dr. Greene, now you brought some before and after pictures here for us?
I did. These patients illustrate the points that I've been talking about. The first patient here, you'll see, she's a young female, and she really came to see me because she was having problems breathing through her nose. Now, granted, she did want something done with the hump as well, and the hump is really a tip of the iceberg because you see the hump here, but on the inside, she had a completely obstructed airway. And so in a surgery, I was able to address both and give her a much improved profile, as you can see here in the after picture, and also open her airway up. So it's really a win-win situation for a patient where they're treated really medically and aesthetically. So it makes a patient very, very pleased. The picture on the bottom is really just to illustrate what I'm talking about. It's very hard for me to show you internally what's happening with the nose and what I'm doing in surgery. But this is so-called base view, and in this view you can see preoperatively there's some nostril asymmetry, a little bit of a collapse of the nose, and these are clues that maybe this patient's having problems breathing. And then postoperatively you can see here there's improved nostril symmetry. Now you can't see inside the nose, but this patient would appear to have a much improved airway, and this patient seems to have a more stable nose. And really, that's the key to this surgery, is that back a long time ago, rhinoplasty was done with little regard for stability and really stabilizing the nose so the patient will have a functional nose that also looks good for the rest of their life. And that's the whole key with doing this kind of surgery.
Okay, now does insurance cover the surgery?
It can. It depends on the degree of nasal obstruction. If there is a problem with nasal function, like a deviated septum, or if there's some sort of a collapse in the airway, then yes, the insurance will partially cover the surgery.
Any side effects, Dr. Greene? Of
the surgery? There can be quite a few if the surgeon's really not experienced in preventing the side effects. That's sort of beyond the scope of this discussion almost, because there are aesthetic side effects and really functional side effects that occur as well. But again, if the surgery is done properly and precisely with skill, then you can really avoid those complications and side effects.
And recovery time?
Recovery time, most of my patients are out of work or school for about a week or so. And that's when the cast comes off. The nose is different from other types of surgery because it takes a while for the swelling to come down. Now, right after the cast comes off, the patient is usually thrilled and they're happy that the nose looks a lot better. But the great thing about rhinoplasty is that the nose really refines over time. The swelling subsides over a period of months. So, it takes, I tell them, a week for the recovery, but really it's months for the really refinement of the nose.
Well, Dr. Greene, thank you so much for being here with us today. And if you're considering facial plastic surgery and want more information, you can visit Dr. www.drryangreene.com or give them a call at 954-651-6600. And Dr. Greene has offices in both Fort Lauderdale and Boca Raton. Roxy, over to the Panda Kitchen with you.